Dr. Alexandre Mottrie is the Professor of Urology at the OLV Hospital Ulst in Belgium and one of the world's leading experts in the Da Vinci robotic surgery method. He specializes in urological oncology and minimal invasive surgery and is the founder of the OLV Robotic Surgery Institute, a multidisciplinary training center for robotic surgery. He's performed numerous prostatectomies and authored several clinical papers and organized multiple international congresses and masterclasses. He's president of the European Robotic Urology Society and of the Belgian Laparoscopic Urology Group. He's also the founding board member of the Society of Robotic Surgeons, and I'd like to request Dr. Mottrie to share his experience in partnering with the foundation at the OLV Vattikuti Institute of Robotic Surgery.
I think for us it's a great honor and a pleasure and to be part of the Vattikuti Foundation network. I am working in a private hospital in Belgium, and the last 10 years we made through a whole evolution, let's even call it revolution. In 2000, thanks to Dr. Van Ermen, who is our cardiac surgeon, we had the second robot in Europe back in 2000. I personally first did not really believe in robotics until I said, let's go to Frankfurt and see Dr. Binder, how he does a robot. I think it was his fourth case. I came in 8 in the morning, I left 6 p.m. Half of the bladder was out, the prostate was still in. It was like not very convincing, to be honest. But then I saw that in 2001, I believe it was, that, may I call him my robotic father, Dr. Menon, had a talk at the WCE at Sharm el-Sheikh in Egypt. So I said to my wife, come, I go on holiday, you join me to Egypt. So we went there, not for the sea, not for the golf course, but to hear one talk, the one of Menon. That's where I said that's the way to go, and then I went the second time to Germany to see Dr. Binder. Then it was only 7 hours anymore, and then we started to do some cadaver trainings, and we started our robotic program in urology. But meanwhile, it was already also cardiac surgery doing their thing. I was doing my thing, and back in let's say two years ago, we founded ORSI, OLV Robotic Surgery Institute. This is really a multi-specialty platform where we all join together and where we join forces, and that has really been a catalyst in our institution. We have now in 1 year not only the ENT surgeons that came in, so we had already gynecology, urology, cardiovascular department. Also the lung surgeons started to do routinely lobectomies and so on. Also our ENT guys started to do thyroid surgery and so on. And also the abdominal surgeons have now really stepped into the program. So that made that we had a rise in number of procedures of about more than 30% in 1 year time. To join the Vattikuti Foundation network was of course the next step, because I believe that the world has become very small. And to join forces, to share the data together, to learn from each other, to share expertise is, I think, very, very important. It helps us to shorten learning curves. It helps us to know and learn little tips and tricks from others, and I believe that is very, very important. To do data management, to do training programs, and I feel very strong that to join the forces within the Vattikuti Foundation network, we can surely become the #1 in this field. So I have to thank not only my robotic father to have put me in the right direction, Menon, but also Mr. Vattikuti to give us this opportunity. Thank you.